All right, welcome everyone. Thank you so much for joining us today for the Innovating for Inclusion, Making Clinical Research More Diverse webinar. My name is Jeanne Jarvis-Gibson, and I'm a member of NIA's Office of Clinical Research, where I currently serve as a health communications specialist. I will be hosting today's webinar, and I'm joined here today by several other speakers, each with different backgrounds and connections to clinical trials. Today's webinar will focus on important tools and perspectives to help improve diversity within clinical research. Today, you'll hear about audience-tested tools like Outreach Pro that support recruitment efforts among underrepresented populations, evidence and practice-based insights on outreach and recruitment strategies, and perspectives from a clinical trial educator and participant. Once all of our speakers have presented, we will have a Q&A session. Please feel free to send us your questions throughout the webinar, and we will try our best to get to them. On that note, I will kick us off. Next slide, please. Ensuring that clinical trial participants reflect not only the population of the country, but also include those communities at higher risk of Alzheimer's and related dementias is imperative to developing treatments and prevention strategies that work for all people. For example, despite evidence that Hispanic and Latino populations are 1.5 times more likely than non-Latino whites to develop Alzheimer's disease, and African Americans are 2 times more likely, they are underrepresented in clinical trial testing treatments for Alzheimer's. Participation in Alzheimer's clinical trials also present many challenges, many of which directly impact underrepresented communities in particular. Strict eligibility criteria, inconvenient trial locations, cost, time, perceived risk, mistrust, and more make it difficult for many people to join a clinical study. Caregivers, who are often family members, often share the disproportionate burden of providing care and support for people with dementia. Adding the additional responsibility of participating in a clinical trial on top of the care they are providing can be a substantial challenge to participating in a clinical trial. Diversity among clinical trial participants is vital to ensuring that treatments and prevention strategies will be effective for all people with Alzheimer's. Next slide, please. NIA is committed to increasing diversity in our clinical trials, and as part of this commitment, NIA released the National Strategy for Recruitment and Participation in Alzheimer's and Related Dementias Clinical Research. This strategy outlined 4 themes critical to enhancing diversity in Alzheimer's disease clinical trials and research. Today's webinar was designed to highlight a variety of perspectives when it comes to diversity in clinical trial recruitment, and the discussion will explore experiences and insights related to some of these goals outlined by NIA's recruitment strategy. And I'll come back to this first goal in a few moments. Next slide, please. And with that said, I'm excited to be joined by a wonderful group of speakers from NIA's Alzheimer's Disease Research Centers, also known as ADRCs. From the Wisconsin ADRC, we are pleased to have Dr. Shenikqua Bouges and Dr. Taryn James. And from the Wake Forest ADRC, we're pleased to have Deb Burcombe and Jimmie Harris. Thank you all for joining us to share your perspectives and experiences today, and we will hear from them shortly. Next slide, please. Today, I will begin by focusing on one of the activities NIA has undertaken to support the first goal from NIA's national strategy, which is to increase awareness and engagement of Alzheimer's disease and related dementias clinical research activities. I'm excited to share Outreach Pro, NIA's free online recruitment materials generator developed to help researchers and research teams create customizable outreach materials. The messages in the tool are audience tested, and it was designed to increase participation and awareness of Alzheimer's clinical research among diverse audiences. Next slide, please. We know that developing outreach materials for multiple audiences has its challenges, and it requires extensive resources and time to create an impactful outreach strategy. It's important that the process uses evidence-based development practices, includes input from the communities that are being asked to participate, that messages are well tested for their cultural appropriateness, that information is available in multiple languages, and that materials resonate with the intended audiences. And one key feature and benefit of Outreach Pro is that the tool allows materials to be customized to meet local needs, another important feature for effective outreach. We also had NIA grantees specifically ask for more recruitment tools to help with their outreach strategies, and Outreach Pro is a direct response to that need and their request. Outreach Pro is just one of the Institute's efforts to bring more awareness and inclusivity to Alzheimer's disease clinical trials and to support grantees' clinical research efforts. Next slide, please. NIA systematically created the materials available in Outreach Pro through literature reviews, listening sessions with stakeholders, focus groups, surveys, and user feedback testing. Research findings from each audience were incorporated into the audience-specific materials. NIA grantees participated in user testing, helping us to improve the functionality and user experience of the platform, and we thank them for their assistance. As part of our formative research, we conducted focus groups as well with a mix of people who are at risk for Alzheimer's disease and those who are caregivers. We learned a lot from the focus groups, and we got to see how terminology and imagery created an impact and how different audiences viewed a message or a concept. Next slide, please. Here are just some of the key benefits to using Outreach Pro. This tool is free and offers customizable Alzheimer's disease outreach materials. Along with freeing up researchers' time and resources, this tool provides messages that have been tested with the intended audiences with the goal of enhancing research teams' outreach strategies. We did audience testing so that research teams don't have to. The site is also 508 compliant. The materials have a professional look that can be customized to include contact information, logos, QR codes, and the template colors can be changed to match different branding colors. Next slide, please. Here is Outreach Pro's current library of templates, where we have a variety of different materials available. As you can see, we have materials available in 5 different languages and have tested the messages with African American, Hispanic and Latino, and Asian American and Pacific Islander communities. Next slide, please. This is the Outreach Pro homepage. As you can see, there are 3 different paths to choose from when you are creating materials. There is the one study-specific path on the left, and that contains customizable study-specific materials. And there are 2 general outreach paths on the right, which are on clinical studies and brain health. We worked closely with our communications office to incorporate general clinical research and brain health information to provide additional outreach material options. Next slide, please. This was a fairly quick overview of Outreach Pro, and we encourage you to log on and explore the site. The 3 main takeaways on Outreach Pro that I can give to you today are that the tool is free, the materials and messages have been designed for and tested with different audiences, and that the materials are customizable. If you're interested, you can scan the QR code just in the middle of the screen to sign up for a more extensive demo of Outreach Pro. And you can also email me or my colleague, Melissa McGowan, with any questions you have regarding the tool. Special thanks to all of OCR and OCPL for helping us develop and promote this tool, Outreach Pro. Next slide, please. Now, I'd like to turn it over to Dr. James to share more about her efforts in clinical trial recruitment at the Wisconsin ADRC. Dr. Taryn James is a scientist with diverse training in biology, pharmacology, toxicology, and the molecular biology methodologies involved in drug development. Dr. James currently works as a scientist at the Wisconsin Alzheimer's Disease Research Center on analyzing hormone therapies in memory decline and increasing diversity in the AHEAD study. Dr. James?
Thank you for the introduction. Good afternoon. I am thankful for the opportunity to speak today about understanding barriers and implementing changes to increase diversity in clinical trials, and we'll be addressing this from the perspective of the University of Wisconsin ADRC. Next slide, please. The UW ADRC began in 2009. In the first initial years, there were passive recruitment to increase people of color into our studies. However, concerted efforts began around 2012 to increase participation of people of color. And by year 2019, our efforts paid off as we were able to recruit about 180 African-American participants and 57 individuals from other underrepresented groups, for a total of about 237 participants from ERG group. At the UW ADRC, we are committed to increasing diversity. And in April 2022, my colleague Dr. Bouges and I applied for a diversity supplement to recruit underrepresented groups into the AHEAD study. Next slide, please. So once concerted efforts began, as you can see here on the right, I mentioned the ADRC began in 2009, where we only had one African-American and one person from other URG groups. But once concerted efforts began, we had steady enrollment of African-Americans shown in blue, and also increased enrollment of people from other underrepresented groups shown in red. On the right side, I'm showing our retention trends. And while retention tends to fall off as a center over the years, which is a common occurrence, we were able to retain participants from African Americans and other URG groups. Next slide, please. Most of the participants that I showed are in the African Americans Fighting Alzheimer's in Midlife study, or AAFAME for short. This is NIH funded, and it's funded now through 2027. And this is a biomarker study with the goal of promoting risk reduction and cures for African Americans. Next slide, please. AAFAME is the resulted from deep engagement work, and this involved hiring people of color, such as Dr. Fabu Carter, who is a true partner and true teller. Engagement was increased through newsletters, events such as brain health fairs, where we can share information with the participants based on their participation, and also by providing services to the participants to help with their needs, such as computer skills class, exercise class, and a service called Wraparound. Additionally, more services were provided, such as virtual and in-person seminars, Facebook Lives, church and community center events, resource events, and cultural celebrations. Next slide, please. So to identify and remove barriers, we have to understand the needs of a community. And this can be done by forming relationships with the community. So we develop community advisory boards, such as the Black Leaders for Brain Health, which started in 2019, and the Oneida Nation, which started in 2016. Here we can work with these community leaders who are church leaders, leaders of the Urban League, etc., and talk to them about what their community needs and any barriers in the community. And this will help us build not only our reputation, not only these relationships, but our reputation, and so that we're partnering with the community to have them involved in research. Next slide, please. Before I talk about this, I wanted to also add that when we work with these community leaders, we listen to their feedback and incorporate that in our approaches to the community. And as you know, one barrier that we have for research is trust and not wanting to take a medication. And Dr. Bouges will cover some of that. So what we want to do going forward to increase diversity efforts is to have more reach within these communities, such as leveraging the use of social media sites. And we had a project similar to this during the pandemic where we were sharing COVID-19 information with the community by not only sharing on social media, but utilizing a community advocate model where we had representative participants from the community sharing the information. So it was a stepwise approach where we translated the information and explained the information to the advocates, and the advocates will then work with our team members to develop posting for social media. So on the left side, I'm showing you an example of this, of something that we posted for World Alzheimer's Day. And on the right, I wanted to talk about another initiative that we have, is that we have an office called the UW South Madison Partnership Office. And this is located in a diverse neighborhood. And this helps us be in the community and have a location where people might feel more comfortable coming to for testing, etc. This site is equipped to do stuff like blood draw, etc. And going forward, we also want to partner more with the Milwaukee site, which Milwaukee is a city where we have more African Americans in Wisconsin. Next slide, please. In summary, the Wisconsin ADRC plans to continue efforts that are successful in diversifying our clinical trial and build on and expand on initiatives. One example is that we recently joined the Alzheimer's Clinical Trial Consortium, and we're working with them where we have participants being stakeholders. And I can answer questions about that later if anyone wants to hear more about that. And then what we also want to do is make sure that our protocols maximize recruitment of underrepresented group and that we're not excluding them from the beginning. We are committed to change, to making change and increasing diversity. And one thing that we need to do for that is to help with trust building, and Dr. Bouges will talk more about that. Thank you.
Thank you so much, Dr. James. Those community partnerships are so important. Next, we have Dr. Shenikqua Bouges, who will discuss the importance of building trust to reduce barriers in clinical trial recruitment. Dr. Bouges is a faculty member in the Division of Geriatrics and Gerontology within the Department of Medicine at the University of Wisconsin-Madison. She specializes in memory assessments, dementia care, and geriatric medicine, with her research interests focusing on developing alternative recruitment strategies to promote inclusive research in dementia studies. Dr. Bouges?
Thank you for that introduction, and good afternoon, everyone. Thank you for this opportunity as well. I will be discussing some of the strategies we use to build trust with the community, as well as some of the barriers we encountered when recruiting participants for a clinical trial. Next slide, please. We use information learned from our Building Bridges study and relationships that were already established between our ADRC with various community members, organizations, as well as grassroots leaders to share information regarding the AHEAD clinical trial. We know that trust is a subjective term with a multitude of definitions and values, which significantly impacts an individual's willingness to participate in a study. The figure I'm showing you highlights some of our preliminary data from our Building Bridges focus group discussions, which was a mixed method study using alternative recruitment strategies to help improve trust and research attitudes in Black or African American participants. And similar to previous studies, we found factors which impacted trust, commonly mentioned within our focus group discussions, was one, having staff members who look like the community, but more importantly, having transparency and sharing results were stressed multiple times throughout our focus group discussions. The participants also expressed a desire to feel valued for their participation, which included incentives for entering the study, but also being appreciated for their time. Next slide, please. And so using the information that was shared Within our focus group discussions and from the community advisory boards, we attended various community events to share various information on dementia topics as well as the AHEAD clinical trial. We offered brain healthy snacks as well as brain stimulating activities like word search puzzles, with some puzzles being more culturally sensitive. We had a Bible word search puzzle, made the font size larger as well for those who have vision difficulties, and provided educational resources to interested individuals. For those who completed a survey to help us better understand the community's understanding and comfort with participating in a clinical drug trial, we provided them with additional goodie bags, which contain those brain healthy snacks as well as some swag items. Next slide, please. We used the Ford conceptual model to help build relationships within the community, understanding that trust building takes time and it must be earned from the community. We help increase awareness by providing community talks on those various dementia topics, as well as having several discussions regarding the AHEAD clinical trial. This provided community members with the opportunity to learn more about the AHEAD clinical trial, but we were also available to answer any questions that the individuals may have had. We asked participants if they would be interested in finding out more about their eligibility for the study and inquired about their reason for participating. Some individuals were willing to participate due to family members who were experiencing memory loss. One individual in particular was very eager to join the study because they were currently dealing with a parent who had a new diagnosis of dementia and was in the denial phase. And that individual was convinced that they may potentially develop dementia later on in life. Next slide, please. And so we also used the community-based participatory research framework, which involved our community leaders in the planning phase and seeking their input on how to best reach the community, similar to some of those strategies Dr. James discussed previously. CARN was the Community Academic Aging Research Network, one of our partnerships as well. Next slide, please. And so some of the barriers we encountered when attempting to recruit participants into the AHEAD study was the age criteria and family history, because a lot of individuals were unsure of their parents' medical history. Some individuals were raised by their grandparents. Next slide, please. Genotyping and not knowing their biomarkers also was another barrier, some other barriers. Next slide, please. And so in summary, some potential strategies that may help increase participation of individuals who are less represented in our clinical trials may include adjusting our exclusion criteria if possible to provide genotyping or checking those biomarkers for individuals who appear to be at a higher risk for dementia based on their family history, and possibly allowing individuals with a strong second-degree family history to be included in the study. Thank you for your time.
Thank you so much, Dr. Bouges. Friendly reminder just before I introduce the next two speakers, if everyone could submit any questions you have in the live chat, as the webinar will be coming to a close shortly. I'm very excited to introduce Jimmie Harris, who is a clinical trial participant and advocate. In his hometown of Salem, North Carolina, he does public outreach and education on the benefits of joining a clinical trial. He also hosts exercise classes at his local YMCA to encourage healthy aging. Jimmie is joined by Deb Burcombe, who is the Program Director of Outreach for the Wake Forest Stick Center for Healthy Aging and Alzheimer's Prevention. Her personal and professional passion is advocating for individuals who are not able to advocate for themselves. Deb and Jimmie, thanks so much for joining us today.
Thanks for having us.
My first question is for Jimmie. I just wanted to know how you first got involved with clinical research.
A friend of mine invited me to come over to the Stick Center and participate in a brain study program that they were having for dementia. And I decided to go, and I tried it out, and I enjoyed every minute of it. From that point on, it's been probably 5 years. I've been going for every study they've had, and I enjoyed myself. So then I went back to the community to introduce what I was going through. And at the same time, I met this shero right here next to me, who was my advocate. And I brought her in, even though she doesn't look like my community, but she was accepted because of who I am. And I told them, this is my angel. So then they believe whatever I say and whatever she says. So she brought programs to our Y in Winston-Salem, North Carolina. It's called the Gateway Y. And she introduced all these different programs to my seniors. I have over 45, 50 that wanted to learn everything they could about the Stick Center. And she did a great job in introducing it to my people. And, you know, being a person of color, we have a little stigma in the back of our mind. We do not trust research because so many things that happen to people of color in research. So I brought the shero. The shero made it so easy. And it just went from there. And from that point on, people were participating. And I, you know, when they say they need somebody, I'm my hands up first so I can go back and tell the community.
That's fantastic. And next I'll go to Deb. As an outreach coordinator, how have you approached connecting communities with clinical research?
Well, I think it's just honesty, transparency. You know, it's say what you're going to do and then do what you said, and just keeping your word. And one of my frustrations was I could share a lot of this good work when I was invited to give a talk somewhere, but that would be kind of hit or miss. And so I thought what we need to do is create our own venue to share meaningful information that will help people. But as part of one of our previous speakers' slides said, you know, we have to be exposed to them. They have to meet us, that opportunity. So we created what was at first in person, a monthly event called Aging Well, where, you know, around 75 people would come every month to hear a live speaker talk on every different aspect of aging well, brain health and body health. And then when COVID hit, we had to get creative. So now we have gone to a virtual format that still talks about those same basic principles of aging well, but we have fun features pre-recorded such as chefs sharing their recipes and virtual road trips to fun places of interest, because we want to keep older adults interested and engaged and active. And, you know, what we found is now we're reaching over 750 people all over this country. England, Ireland, Canada, and Germany are now learning about the work that's going on and how does that affect research. At the end of people's talks on whatever different aspect of work they're doing, people are saying, how can we get involved? What can we do? How can we join?
That's awesome. COVID has kind of changed the way that we all connect to different communities. So, you know, I'm glad that Aging Well has grown even, you know, outside of the US, but in the world. So that's very impressive. Jimmie, my next question is for you. What motivates you to participate in this research?
The clinical research is something that I enjoy because of learning something about my body, learning what's going on within my mind, teaching me how to react, how to eat, how to be physical, how the brain works, what music does for my brain, because I take that music and I take it back to the community and I teach them dementia. If your brain is working with music, it helps the brain to grow. So I use my music at the Y to teach my little seniors, well, not take that back, not seniors, active adults, because they're not seniors anymore, how the music changed their lives. Because I make them repeat the song or sing the song while they're doing their exercise, because we do like a 5-mile dance for 1 hour. And when they finish, they are so happy. You can see the difference, the transition from when they first started. Because when I first started this class, I had 3, and now I'm up to 50. And what I do for them is tell them what I do when I go to the Stick Center. And what you do is you drop the breadcrumb and hope they will follow you. And when I drop the breadcrumb, my shero right here next to me, she comes in and she introduces all these wonderful things to my little active adults. And the only reason they trust her is because of me. Because if you look at her and look at me, there's a color difference. And in my community, they don't trust. The only reason they trust this young lady because they trust me. And when she come with this information and you make them feel so welcome, because she's a humble person. If you look at her, she's very humble. And that makes her different because, you know, they can sense when you're not real. Old folks got that sense. And so she come in and she make them feel like they're part of her family. She's not standoff. She comes in like she can just hug them and eat them alive. And that makes a difference. And that's how you get them to come to the studies and understand what's going on in the community at the Stick Center, because the Stick Center is a big part of Winston-Salem. Mm-hmm. And when you go in there, they make you feel like a family. I've been going because everybody knows me by my name now. When they see me, if I don't come for a few months, well, what happened to Jimmie? Why is he not in a program? So I went 2 weeks ago, and they all just came to meet me to say, we haven't seen you in a while. And that makes you feel wonderful within. And when I did the brain study thing, it's just, oh my God, you just wouldn't believe my brain just changed on me. And I was so glad to go back and tell all my active adults, you need to follow me because we're old now. We have numbers behind us. We have old years behind us and we have in front of us. So I want to enjoy what's in front of me. So the Stick Center has given me that opportunity to look within myself and throw it out back to the community. And thanks to this young lady next to me, she makes me happy to want to be a part of this situation. Without her, I don't know what I would do because she has done so much for my why. And I appreciate everything she's done for me and my people. Thank you.
Well, it's mutual. Mm-hmm. And I want to give a shout out to the work that our team has done at Wake Forest. So the African American demographic, the population of African Americans in North Carolina is 22.2%. In our studies, I got this report this morning, our African American participation in our studies is 23.7. So I'm so proud of that, not to check a box, but to say, I feel like we are working so hard to reach, to connect, to embrace a population that may not have been invited to be a part before, maybe hesitated to be a part before. But I feel like what we're doing is having an impact because we want to change people's lives for the better.
They must know someone in order to participate. So they know this face and they know that face, so they know it's worthy.
And sometimes it just takes two connections.
There it is right here.
Yep.
You know, because I bring her and push her in front and let her do all the talking. And they're like, Jimmie, if they can't get what they want, I say, call her. And they'll call her and she'll make it happen, just like that.
Because again, just keep your promise.
That's the key to the thing.
Mm-hmm. Jimmie, is that what you tell others just about getting involved in community research? It's brain health and everything that comes with everything that you've learned the past 5 years?
Yep. I make sure it's a mental and it's a physical thing at the same time. Because when I went to the lumbar puncture, I had to explain to them that the needle does not hurt. Because, you know, when you say a needle, you're not going to stick me. And I had to explain to them that 3 times I've had it done and I enjoyed every minute of it. And they said, you enjoy a needle? I said, I was hesitant at first. I said, but you won't feel it because the people who are doing the research behind you are conversating and making you feel comfortable enough to enjoy what's going on without being in fear. And I wanted to let them know there was whatever fluid they took out of my body was a roadmap to my whole body to tell me about my body. So this is part of the study that I try to tell my active adults about. I said, you need to learn about your body. That's because in our situation, they cannot design a medicine for a person of color if you're not in the study. So in order for you to get medication for your particular bloodline, you have to be a part of the bloodline. You have to give to understand. You have to make sure you're in there with that study because most of the medicine is circling around white men. So everybody take this medicine. It's a shield. So if you're there giving up your blood and giving up your time and your brain cells, then you're part of the study. So you're helping the situation by being there. So you can take that back to your church or back to your community or back to wherever you want to go. But in my situation, I take it back to the why and explain to them. And they'll follow.
Yeah.
All I got to do is say dead.
And spreading the word.
And from his group at the Y, we have met so many great contacts. It's led to then making these presentations in churches and community centers all over the area. So, you know, again, you get a champion like Jimmie
And then she wrote like right there.
The sky's the limit.
And I'm gonna show. I have a letter here that someone in my class gave me Monday, thanking me for pushing her into the study, and it saved her life. It's one of those letters that make you want to cry when you read it. You know, I'm just so happy because she came to me and she said, Jimmie, if it wasn't for you, I would have never known that I had a problem. Because I've never been sick. I never had anything wrong with me. But I got into study because of you and this young lady right next to me. And it saved my life.
Well, thank you for your powerful words. You both are truly inspirational, and thanks for sharing your perspectives with me today. I truly appreciate it. So thank you. I think if it's okay, we're going to move on.
Always.
We're going to move on to the Q&A session, I believe. Sorry, just looking at the questions. Bear with me. Okay, there's one question for me. Sorry, it's the first one I saw. Is Outreach Pro available only for NIA grantees? No, Outreach Pro is available for any organization, any person who's doing outreach marketing. If they're, clinical researchers, Outreach Pro is available for everyone, not just NIA grantees. Okay, there's one for Shenikqua. Do you have any recommendations for a study that is already underway to refocus recruitment outcomes while under a time restraint to recruit participants?
I would say, just as to summarize, despite having the time constraints, not to forget that building trust takes time, and not focusing on the time, but the partnerships you're building with the community, because they can sense that as well.
Yeah. And Dr. James, I have a question for you. And thank you, Dr. Bouges. In what situations do you give the puzzles? For example, do participants take it home or do it to fill time during visits? What are some other activities or brain healthy snacks you can give out?
Thank you. When we're at community events, we give out puzzles as an extra incentive. We tend to do surveys at the events as a method to gauge research attitudes, especially that people are, one of the barriers is trust and not wanting to take a medicine. So we normally do these surveys and give the puzzles as an incentive, and they do take it home. And brain healthy snacks include healthy nuts.
You said nuts?
Yeah.
Okay. All right. And I have a question for Deb. The type of work you do seems really important. How are you able to get community buy-in to begin hosting the Aging Well event? How are you able to keep it growing to get these events to reach a national level?
It's just a personal passion. It's something that if any other viewer today is interested in replicating in your home site, it's absolutely free. I mean, I will tell you it's a lot of work, but it's just being able to connect with older adults, as Jimmie says, active older adults, to find out issues that are important to them. Well, we work at a medical center. So typically if, say, diabetes is of interest, then typically I can put my hands on a great either diabetes physician or educator, and we line them up to give these presentations. What we do is totally free. It's free for people to participate. If anyone ever wants to join, it's just, you just email Aging Well Series at wakehealth.edu. And it's totally free and could easily be replicated anywhere in the country.
Thank you, Deb. Jimmie, there's a question for you. What messaging have you conveyed that you believe is the most effective in getting underrepresented populations to consider a clinical trial?
Dementia and music, and explained it in what music does to the brain and the movement of the body, and what the Stick Center has to offer as far as dementia or Alzheimer's, how it kind of connects. And if you don't use your brain, you lose your brain. And if you go to the Stick Center, they kind of like put you through a program to kind of like stimulate your brain again. So I'm in that program where they stimulate me. And once they stimulate me, I take it back to my active adults at the Y, and I share all the information that is placed in this brain. And they feel happy. If they see me happy, they'll be happy. So this is my method of getting them to try certain things. Like she was saying, certain foods like nuts and stuff, I tell them about the healthy nuts, healthy food, because I went through that program also, where they taught me how to eat, which was really wonderful. I did good until, after the program, but it was wonderful while I was in it. But that's my key to my community.
Thank you so much. And it looks like this is the last question. This is for Dr. Bouges. Your presentation covered a lot about the importance of building trust when recruiting underrepresented populations into clinical trials. If you're starting with a group who has little to no trust in clinical research, what do you see as the most important first step in building that trust?
Great question. And I would say that one of the most important first steps is speaking with the community to see what their need is. And so that needs assessment, so you're able to provide a service to them first and foremost to help you build that trust. Because they want to feel like they're benefiting from this clinical trial as well. And it'll be a lot of work with just building that trust first.
Yeah.
Yep, that's true.
All right. Well, thank you, everyone. Thank you to all of the speakers, and thank you for all the attendees for joining. And I hope you learned a lot from this webinar. And again, thank you so much for your time.
Thank you.
Thank you.
Thank you.
Thank you.
Bye-bye.